Welcome to our channel, or if this is your first time, we thank you for joining us. Today we have a very, very special treat. We have Dr. Igbinosa, and correct me if I say it wrong.
Right.
Igbinosa, and she is an obstetrics gynecologist, and she's very, very knowledgeable about maternal health, Black maternal health, especially in the U.S. And so we are so happy to have her here with us. Such a pleasure. So thank you for joining us today.
Oh, no, thank you for having me. I'm excited to be here.
I have a question to start us off.
Oh, okay.
What major, and this is not on the list I gave you, but like what, but it's something you can answer easily. Like what made you go into specifically the field of, gynecology and to be an OBGYN? What made you want to do that?
I think that's a good first question. So I have always been passionate about women's health. And I felt like OBGYN, we could say it briefly, is like a unique way to like connect with a woman throughout different stages of her life. And so whereas where you're going for, like for medicine, more so like a problem-oriented complaint, like, you could see someone through preconception, before, when they're trying to conceive, when they're conceived, and then you see them again for the next pregnancy. And then specifically, my interest is really high-risk pregnancies. And so I think that just further like evolved out of doing I did private practice for a while, and just like seeing that this is like an extra need where, we need more people represented. And so, and it's an interest of mine. So, yeah.
Yes.
Awesome. That's awesome. And I commend you because, especially being a high risk, pregnancy person, I love, doctors who really, really care and know about, high risk. They, are truly passionate about it. And, we can tell that you are, truly passionate about, just high risk and, making sure that the mothers are well cared for. So thank you.
Yes, and I think because a lot of people are like, oh, where are all the Black OBs? We are out here, and so
oh, good.
I just want to say it's like I'm part of a community, of people who want to take care of, Black women and get them the best outcome that we can.
Yeah. And so today, just with the pandemic, we do have, a few questions that are, COVID related, because we want to know, especially when it comes to being pregnant during this time, like what are the best ways that someone who is pregnant, a woman who is pregnant, can protect themselves?
Yeah. I mean, so, COVID has thrown everybody for a loop, right? This is, unprecedented in terms of like its nature, and it just caught everybody where they were. And I think to answer your question, for women who are already pregnant, it's, a lot of the same precautions apply. I know there are going to be different nuances based off of where you live. But I think in general, I recommend the CDC guidelines, which is wear a mask when you go outside, try and social distance at least 6 feet. And just if you're in public spaces, like, we have to grocery shop, we gotta go get gas and those things, like, you take precautions where you are. And then the other thing I would caution is that I think as we've been in this, depending on where your state or city started, you've probably been in shelter in place a while, and some people are getting tired of it and they're like, oh, it's over. It's not over. So I would still caution people, like, not to, like, this is not time to throw a party, or, like, I would still just really exercise caution, especially if you're pregnant and you're, we're still finding out new things about this COVID. Like there's journals, there's papers every day coming out. People are publishing as they find out things. So, at this point, I would be like, out of abundance of caution, be conservative.
Right.
Awesome. And to piggyback off of Christy's question, so for a pregnant woman who's about to deliver in the next week or 2 weeks, you know, I had just sent Christy an article this week about a young lady who died in a hospital in New York after a C-section. Nobody checked in on her, you know. So how can women, because I mean, having a baby is stressful enough, you know, like
we've all been there
going on in your head, you're scared, especially if it's your first child. So how can a woman who's pregnant now, who's about to deliver a baby in the next few days or few weeks, prepare herself and her significant other for what they will experience when they go into the hospital? And, you know, I know every hospital is different. Some are allowing spouses to be there and some, you know, are not, unless it's an emergency. So how can women prepare?
Yeah, that's a tough one. I'm not gonna say I have all the answers. Like, you know, even being on this side, I'm not pregnant, and I can't imagine, you know, when I was pregnant and delivered, I had the option to have all these different support people in the room. And because of COVID, like, depending on, you know, I have friends in different places, you either have one support person, you know, whether that be your partner, a family member, whomever, or if you choose for that one support person to be like a labor, like a support person, like a doula, like whatever it is, you get one person. And some places you get 0 people. And so, you know, I have a lot of feelings about that, and I have to say, just I speak for myself, not any institution or anything that I'm associated with, have been associated with. But I do think there are ways that we can still advocate for ourselves. And so I really feel like, you know, in this, one of the ways is like, they can't physically be in the room, but you can have someone on speakerphone, you can have someone virtually be like an advocate for you. And I think healthcare workers, I know there's a lot of variance, but, you know, a lot of people sympathize with like, oh, wow, like here, you know, she's by herself, like this person can't be. And so some of them have stepped in terms of being willing to like speak more with a family person on the phone or being available to give updates. And so, I mean, I think that's hard, but like, you know, you're gonna be tired, you're gonna be sleepy. So I think just like in terms of a plan, like an action, I would like, if it was me, I would have my loved ones know where I was, who was taking care of me, and empower my family with a way to check in on me. Like, hey, you can't be here, but this is who my care team is before things get really like dicey. Because you have a right to know that, and you can share that. They may not be immediately accessible to you, but they can still know what room you're in, who your doctor is, who your nurse is. Like, I feel like your family should know that. A lot of times we just go, you know,
yeah.
You ask somebody like, who is that? You don't know. And so I think just learning who's in the room, like, and it's okay to ask that, like, you know, hey, you know, this is a different time. I just want my family to be able to check on me.
Yeah.
And so, like, forgive me for my ignorance if this is something that's already out there and published, but are, like, for the specific hospitals that may not allow anyone to come into the room, are they at least allowed to be in the waiting room, like a spouse or, you know, whoever they may choose? Are they allowed to be in the waiting room, or is that not an option either?
It really does vary. Some are there's some hospitals like nobody. Some are making exceptions for, okay, that one person, and that's your one person who follows like baby to the nursery if mom chooses to go to the nursery. And I think like the reason for this is, like, as we've seen, COVID is so easily spread, even if someone doesn't have symptoms, and not every institution or place has the capacity to test widely. And so it's really out of protection for the mother and her baby that all these things have kind of been put in place where they're trying to, like, in a way, incubate mom and try, like, but there's so many variables. And so, yeah, so that's a hard one to speak at large. But there have been published reports where people who, now our healthcare system, we already had different levels of equity, right? Depending on how people are treated and their access to care. And this does present a barrier for some women. And I think it's important for us to acknowledge that and provide how can we go through the barrier? How can we go over? How can we work around it? We can't just say it's going to be the same for everyone. We know it's not.
It's not. Exactly.
And so is that something that you have been seeing? Because we already know the, maternal health rates and the mortality rates for Black women and other women of color, and even, Black infants is so much higher than, with white women. And so is that something that we're seeing even more so with coronavirus, there are more Black women and women of color as well as Black infants, dying from coronavirus?
I think at large, a lot of this stuff is not published yet, but what I can say is general stuff. And so in general, we are seeing that disparities are consistent with COVID. Another way to say it is it's been exposed further with COVID. I feel like we've already known that these disparities exist. I mean, it's been in the press, it's Serena Williams and, other, we know, but I think, I don't think that's changed, that's the best way I would say it. I would say that it's very consistent. I think in places where Black women have less access to care, you're going to see more disproportionate outcomes. And it's not just access to care. I won't make it seem like it's just one thing, but that's a tough one. But I think the one maybe potential thing to think about is when you think about the flu pandemic, the H1N1, 2007, 2008, pregnant women were really impacted just in terms of numbers, just in terms of sheer numbers. And we're not seeing those same numbers for COVID, but it's still pretty early. We're still learning new things about what COVID, for some women, they may not have symptoms, and some are having to be delivered early, or some are there's reports along the whole spectrum of so I think it's still at a point where I'm still cautious, but there are some people who will say that, well, the sheer numbers, when you look at the absolute numbers, it's not the same as flu.
Okay. Well, that's hopeful, I guess. We would definitely hope that it would, stay that way, that pregnant women are not as affected, as in some of these past pandemics that you mentioned. That would be awesome. But, of course, we know that we're still kind of at the beginning of this whole thing. And so we don't really know how it's going to play out. And so I do want to know, when it comes to a pregnant woman who has contracted coronavirus, are there any additional precautions that she should take, for the fetus, for her baby, or are there any other things that doctors are able to do to kind of make sure that the baby is protected?
I think that is it's a very involved, I think at the point that someone is pregnant and they have COVID, there should be a discussion with their healthcare team. And some women have been low symptoms, are able to be home and then just kind of conservatively managed, but then some women have to be hospitalized. And so I think that that counseling depends on what symptoms they have. I will say just broadly that if someone is at the point that they're home, it is still important to do your regular stuff. Are you feeling baby move? Do you have labor symptoms? Are you bleeding? If there's essentially my advice is like, if you have a question, ask. Like, I know a lot of people like to, you know, look it up on the internet. This is not the time for that. I think like if you don't know, there is a healthcare professional that you have access to, and you should ask them. That's what they, you know, that's what they're available for. So I really don't think there's time to just like, oh, I'm asleep on it. Like if you feel like if you have a fever, you have a cough, a sore throat, like I really think, you know, or if it's not getting better, like let's say you had some of these symptoms, you were diagnosed and you were well enough to go home, but things change, communicate that. Because I know that you guys probably have also seen the reports of these were non-pregnant people, but people of minorities who were sent back, like who said, oh, I had this and they didn't test them and this. And I do think there's something to being like, if you don't feel right and you're not getting those answers, to still request of the system, still push on the system.
That's a polite way to put it.
Yeah, it's just like, I'm back. Like, you know, like,
yeah,
I really do, you know, that's a whole nother layer, but in terms of what we can do, we don't have to go away if we don't feel like our needs are not being addressed. If our concerns are not being addressed, then I'm still here until those concerns are.
Exactly. That's one thing that Christi and I have often drilled in a lot of our videos, like you have the right to fight for yourself. And if you can't, you need somebody just as gully who will get there and fight for you. If you're physically unable, you need someone to advocate for you, to say, hey, no, we need to figure this out now. And I think that a lot of people are intimidated because they may say, well, I don't have the degrees the doctor has, so maybe they're right. And maybe, you know, because I've known people personally who have done that and just listened to a first opinion. I'm like, no, you need to go back to the doctor and figure out what's going on, you know, and then come to find out they had something completely different than what they were originally diagnosed, you know, and it could have been detrimental. So it's very important to advocate for yourself and to fight. And if you don't feel right, see another doctor. If that doctor is not trying to give you the answer that you want, ask for another one. It's okay. It's not going to, you know, get you in trouble or anything like that. And I think that's what a lot of people, especially in lower income, you know, neighborhoods and, you know, who don't have the access and don't have the wherewithal, they may, you know, back down easily and not fight as much because there's like, well, I don't even know if my insurance will cover this anyway, or whatever happened. And yeah, fight.
And you made me think of like a good question. You say fight, I say advocate.
Yes. Good one.
But I think there are organizations out there that can help you. Like, so I know that, like, for example, for labor, there are some doulas who have offered virtual services, right? Like to be your virtual person. There are different, like now there's telehealth and there's so many different ways to get a medical opinion, and there's so many different options. One of that comes to mind is Our Culture Cares, and it's it's a platform that kind of tries to, for those who really want someone who, you know, want physicians of Black African American physicians. That's another option. But there are others, you know, and then in terms of like maternal organizations, there's Black Mamas Matter, and there's so many different things that that, like, if you don't feel like, oh, I'm being heard or I need help, there's different avenues, there's different options. And I actually really like the telehealth option, because if you're limited by zip code, you know, now the internet opens you up to all these other options. And in the era of COVID, where you're not really trying to go in person everywhere, if you don't have to, this is just a side plug. Like, maybe you need mental health resources. Look, you can do that online. Like don't feel like everything has to stop in terms of your self-care and well-being because of COVID. But that's a whole other topic.
True. No, that's true though.
But speaking of telehealth, because I know, like, the article that Christi sent me the other day about the woman who died, she did, you know, reach out to her doctors through telehealth, and they essentially dismissed her, you know, just like they were doing when she went in person. And so you say going to, you know, finding another doctor or whatnot, using the telehealth system. Is that something that somebody needs to be concerned about, like, you know, with their insurance and everything, making sure that it's a doctor within network? Is it, you know, does it work kind of the same way?
Yeah, I think that's a good question. I do think you're gonna have to check. Some do it independently, and some, it's like if you're trying to go through your insurance, you are gonna have to make sure you go through your insurance and check beforehand. But I think, how do I say it, is that you have options just within your network, right? So some people, depending on your insurer, like if the relationship is not working out with the initial person, you can investigate within your insurance network. And so that's an option for people. And then to that article, I don't know if I'm referencing the same one, but I think that goes back to our earlier point is however you're reaching out, whether it's in person or virtually, but if you don't feel like you are being heard, then I think it's like, okay, don't feel like it has to stop there. There's other ways to be heard, and you know, maybe that person just, it wasn't you know, I can't speak to the specifics of that, but there you know, there are people who can help and are willing to help, and I think just navigating that is important.
And I guess I have one final question, unless you have another one, Christi.
No, go ahead.
Okay. So what would you recommend for like people, women who are trying to conceive right now? I know some people say that's, you know, not quite recommended, but, you know, of course, if some people feel like, you know, this is my only opportunity, you know, I want to take advantage, whatever, you know, the case is, like, what would you recommend for them?
You know, I thought when you guys said that question, I thought it was a really good question because that's come up a lot. Especially for those who are at the level where they need, like they already have eggs or embryos in place and we're already on a cycle and it got stopped because of COVID. And so I think, you know, that's different levels for each person. You know, right now, there's still question about vertical transmission, like meaning that if mom gets it, does it go to baby? But so far in the case reports and stuff, again, you know, we may not know some stuff till later. It seems that people are doing okay and their fetuses are doing okay, but there have been some reports that suggest otherwise. So trying to tease through that is still in the early stages. So I guess to the individual person, I think it's going to be like a risk assessment. Like, where are you in your, you know, pursuit of getting pregnant? Like, can you afford to wait? If you can't afford to wait, like, I think that's going to be a discussion with, you know, you and your fertility team. Like, okay, because for some, especially if you already started the cycle and everything, and you know, we don't know how long this will be. Not everyone can wait. Exactly. So and it might be okay. And so I think it's really going to be down to like the individual, like, can this person start or not? I will say, as things are starting to kind of slowly, like a different stage of reopening, if you will, that some procedures are those are being added back on in terms of retrievals and stuff, whereas that wasn't an option for some women like 6 weeks ago.
Yeah, because this is all according to the board standards, right? Because doctors have to go according to what, the American Medical Board. Yeah, so, you know, they're the ones who will let you know, can you proceed with this procedure?
Right. And that's going to vary by where you are. Like, if you're at a place that's not seeing a lot of cases and et cetera, they may not have stopped, you know. Whereas some places, like, for example, New York, there definitely a lot of things were on hold.
New York. They'll be like, that's not a priority right now. Unfortunately.
Right. Yeah. So I think it just really, you know, it depends on where you are. But I think if you're thinking about it, you know, like, so I think this is my other plug. A lot of people wait till they get pregnant to then talk to their OB about their concerns and et cetera. I think at the time that you're thinking about getting pregnant, that's like a perfect time to establish a relationship with an OB. And in fact, it actually takes a little bit less pressure off of you. You get to get a feel for their style. It's really just like, you don't have to get really examined sometimes. It's just really like a conversation about, this is my medical history. What am I at risk for? You know, and that's different for everyone. And, you know, some women don't realize that they don't have to stop taking certain medications or et cetera, et cetera. And I really think we don't utilize that enough. Like, you can see the OB before you're pregnant. It's okay. We're okay with it.
I like that you said that, because I honestly would never have thought about that, you know, because unless it's to, you know, get your exam or, you know, after you get pregnant, I would not have thought to strike up, you know, a professional relationship with an OB ahead of time so that everyone is on the same page throughout the process. And I think that that is very important. And that's something that I myself will, you know, consider and, you know, keep in mind going forward.
Oh, for sure. And I think I will say, like, for OBs, our work is kind of hard to move virtual, but that is one visit that I know a lot of OBs are now offering through telehealth, because, you know, if you've already caught up on all your other stuff, this is really just about, like, what do we need to do that we're working together to get you the best outcome.
Yeah.
And, you know, we don't need to wait till your first or second trimester, the end of that, to establish that. You know, like, some people don't know that take prenatal vitamins before, you know, like, when you're even thinking about getting pregnant. Like, all these things are like things that can be reviewed.
That's good. Good. Anything else, Christi?
I don't think so. Just thank you again. This has been so informative. Like, even for myself, you know, someone who has had to actually switch doctors almost in the middle of a pregnancy, you know, it's good to know that you are able to establish, you know, your doctor even before you're pregnant. And so I think that's very important to know as well. Is all the other information that you've given us. So just thank you.
Yes, we appreciate it.
Well, I have to give you two a shout out, because I have to say, like, I share your content, especially because you're so candid about your fertility struggles or just having, you know, issues with high-risk pregnancies. And I feel like people don't really hear that. You know, we really hear, like, oh, like, the child is here and not the journey for that. And so I thank you, because I've been able to share that with people, like, oh, who feel really alone. And I'm like, well, look, you're not alone. But, you know, it's such a sensitive topic that I think a lot of times people put themselves like, oh, nobody wants to hear it, or, you know, no one else has that problem. So, you know, I know you guys have published books and you have this, and I just have to say thank you, because I really do think it is something that, even though I've trained in this, like being on the side, we're seeing patients and stuff, I can't tell you how many people feel alone in their struggles and find it hard to reach out to someone to talk to.
Yeah, it is. It's hard. Thank you. Thank you so much. Do you have any works of that you're working on to get published? Any papers, any research, or are you currently, or is it still hush hush until it's done? Because I know doctors are always working. They're always, you know, in your mind, I know your mind, you're always that researcher mind. So I'm like, I know you got something in the works.
I'm very, very much, but I will say one thing that I'm very passionate about is, like, how do we improve outcomes for Black mothers? Like, as you started off, is like, you know, we really do have, like, in terms of, like, rates of maternal death, is like it's higher than others, and I'm really interested in, like, solutions for that. And I think those solutions are complex, and But that's where like a lot of my research interest is, like, how can we improve systems to improve access so that at whatever level someone interfaces with the system, they feel supported, right? Because it shouldn't, it's funny because you gave an example like, oh, be ready to fight. And I actually think that is actually how a lot of people feel. Like, you're supposed to be coming to be taken care of, but our guard is up because they're like, oh, I don't know if this is going to be the right, like I don't know it. And I think that takes a toll of us. Like, we are supposed to enjoy this experience just like everybody else. And I feel like our joy is important, and we should be able to embrace that in pregnancy. So that's in general, like I like to speak widely. It's like, that's what I like.
Okay. Well, we'll look out for any works that come in the future.
That is exciting to me. Like, I cannot wait, because we'll definitely have to get you back on.
Yes.
Because that's a passion project as well.
Mm-hmm.
Yeah, no. Well, I mean, yeah, this is fun. And see, look, I told you they upgraded your time.
Yeah, they did. All I had to do was click love it. I'm like, yes.
Oh, cool.
Yeah.
That worked.
Yeah.
So thank you so much, Dr. Igbinosa.
Well, thank you, Christi and Christie,
for being with us. And for those who don't know, Irogue is my cousin.
And we love you.
I love you so. But I really appreciate you taking this time out and sharing your professional expertise with us, and just having a candid conversation about this, because I think it's very important, and I think that it will help a lot of people going forward, not to just continue to perpetuate the fear that we're hearing in the media, but something to give us tools on what we can do to advocate for ourselves and to kind of just instill that hope. Because like you said, this is a time, especially for pregnant women, where they should be enjoying the pregnancy, not living in fear of, am I going to survive the birth, or what's the experience going to be like at the hospital, and different things like that. So, and I think to piggyback on what you said, even during your pregnancy, being openly communicating with your doctor and saying, hey, what am I going to expect here? What are the steps here? What's going to happen? Probably could help you as well, just kind of ease some people's state of mind, so they'll know what to expect, even though things change.
Yeah. I will definitely give you guys, because I realize I said some organizations and I don't even know if you have them, but I'll give you those links.
Yeah, I wrote them down.
Oh, perfect. Yeah, I wrote some down, but yes, the links would be perfect.
They could just follow them on Instagram or whatever, because there's one specific for mental health, there's specific for midwives. I didn't talk about that because I'm not a midwife, but I do think, I think that's a great option too,
Yeah.
But yeah, there's so many things that it's just not all in one place.
Yeah, I can imagine. Yeah. So please definitely send us that link, because we'll add that to the description when we upload the video.
Okay, sounds good.
We appreciate it, girl. Thank you so much.
All right, ladies. Bye. Have fun with your little one.
You too.
Thank you guys for watching, and please continue this journey with us. Love you guys.
Bye.
Bye.